I'm Chris Van Bergen. I'm a Senior Program Manager at North Country Health Consortium, working in the program areas of the Integrated Delivery Network, our Area Health Education Center, and the Public Health Network. This year, with our Integrated Delivery Network partners, we've really tied down some of the great progress that we've worked on for the last 4 years as we've worked to improve the workforce in our region. That workforce is really professionals who are helping us integrate medical care and behavioral health care for our region's residents. We've also looked at ways to leverage technology and, most importantly, to strengthen partnerships across the region. Now, for the Integrated Delivery Network, that's meant things like improved access to substance use disorder treatment and improved access for professionals to training, which ties in nicely with our work as an Area Health Education Center, where we both deliver continuing education to existing professionals and encourage students to enter health careers. Our work in the Integrated Delivery Network set us up well for what happened in the middle of our fiscal year when the COVID pandemic arrived on our doorstep. It has certainly been a year to remember. And on the Public Health Network side, for us, that has meant leveraging those strong relationships with our area partners that has helped us coordinate the region's response to COVID-19. It's helped us make sure that we stay in touch with one another to ensure that our most vulnerable citizens are getting the services they need in times when access has seemed challenging because we've followed stay-at-home orders. And it's made sure that we continued to deliver the really strong healthcare and human services that are available in the North Country.
Hi, my name is Annette Cole. I'm the Public Health Program Manager at North Country Health Consortium. I work on several public health initiatives, and one of them is oral health. Last year, at about this time, I started working on an oral health initiative that focuses on outreach and education for childcare providers and preschool staff, as well as the parents of children who attend the childcare centers and preschools. The initiative involves face-to-face presentations that train staff as future trainers at their preschool or childcare so that they can continue on the oral health education efforts to train new staff as they join. The initiative was off to a really great start, but in March, all of the presentations had to be canceled. I stayed in touch with all of the childcare centers and preschool teachers and worked to revise the initiative to become a virtual interactive presentation and to include a contact-free delivery for the oral health toolkit that provides supplies and materials for this preschool and for the staff and for the teachers and the families. In late summer, I reached out to the directors and the childcare centers again, expecting that because they were seeing an increase in their enrollments that I would begin to start to reschedule the visits for the virtual presentations. And overall, the response from the preschools and the childcare centers was very similar. We were seeing that they had more staff and more students, but they weren't at full capacity. And the owners and directors were looking to be fully staffed before hosting me for the presentation because they wanted to get the full experience for their staff and their families. And with all the issues that the directors and the preschool owners are seeing every day that are caused by the pandemic, such as homelessness, food insecurity, and unemployment, they sustained their prevention-oriented views for oral health, and they continued their commitment to supporting oral health for their population. We try to respond to disruptive events by being flexible, and I think that that helps us to be resilient, but it's easy to understand how oral health could fall to the bottom of the list during what feels like catastrophic times caused by a pandemic. But what I was hearing from the teachers and the directors overall was that they continued supporting the priority of oral health in their population, and that they saw that it still remained important even among all of the issues that have been caused to their families and their young children attending their preschools caused by the pandemic, that they still very much valued oral health. And it was quite a surprise. And it made me feel that the work that we do in public health, our efforts to serve this community, have been well received and supported.
Good morning, everybody. My name is Laura Remick. I'm the Workforce and Education Coordinator at the Northern New Hampshire Area Health Education Center, one of the programs of the North Country Health Consortium. And so I'm going to tell you a little bit today about some of the work that we do through the AHEC program, the area. So one of our programs is a Live, Learn, Play program. And at this time, we only have funding for students who are in the behavioral health fields. And I had a recent student who I interviewed via Zoom. With this whole pandemic, we've been using Zoom all the time. And I had in the past been doing phone calls. So through Zoom, we were, face to face a little bit more. And I was telling her about the program and the community project of her choice. And I let her know that she was accepted in the program. And I could just see that she was like so appreciative that she was almost starting to cry. And it's a stipend. It's a small stipend of $1,000. It's not a ton of money for a student who's in school and has a lot of debt. And it's intended to help pay for housing or gas or those kinds of things. But it was just so touching to me that she was just so emotional about getting a little bit of money to help her through the process, and that we were interested in what she wanted to do for a community project. So that's one of the benefits of the pandemic and the resiliency. You always have to look for the silver lining, I guess.
My name's Bob Thompson, and I'm a senior program manager here at the North Country Health Consortium. Primarily what I oversee is the substance misuse prevention portfolio. So we have a substance misuse prevention network that we oversee within Coos County and Northern Grafton County, and that's region-wide. We also have a drug-free community support grant, which is behavioral specific. It's a coalition that does prevention work in that area only. We have a continuum of care program, which runs through the whole continuum, which is prevention, intervention, treatment, and recovery. So that's the one program we have that addresses all the components of substance misuse. We have a student assistance program that we implement in middle and high schools in a number of the North Country SAUs. We have a young adult strategies program, which addresses the needs of the 18 to 25-year-old age group. Our focus is alcohol, tobacco, which includes all nicotine products these days, as well as other drugs. Raising awareness and finding ways to address prevention in ways that work in communities requires understanding communities, and that requires building effective working relationships within communities with the key stakeholders who are also kind of focused on the things we do. So mining down into North Country communities and getting to know the people that are there and what their concerns and passions are is a big and important piece of effectively doing the work that we do. Is extremely different than what we could have envisioned it being 12 months ago. So that really is a great example of the importance of building resilience within ourselves, and especially in youth that are doing everything different, and stressors are more pronounced, and people can feel overwhelmed a lot easier and be feeling like they're missing the advantage of direct social contacts. But the more resilient we can be through this time, the stronger we're going to be when we come out the other end.
Hi, Williams, the Substance Misuse Prevention Coordinator for the North Country. Recently, due to COVID, we've had to shift some of our plans. We've had to shift the way we disseminate prevention to our youth. The UP conference has changed. We've been doing it for 4 years, and now we've changed to a more virtual format. So thankfully, we've been recognized by the state for shifting our approach and being successful and creative in the approach that we take to getting prevention to our youth. These programs have touched a number of youth in many ways, a lot of it kind of unmeasurable, but some of them directly. And there's one that comes to mind. It's a young man who was living in a less than desirable situation. His home was full of substance misuse. He was a very good kid. I came in contact with him through working on a project for UP, where I was helping some of the art projects go forward. I sat down and spoke with a group. I recognized that he had a lot of talent, but he was very shy, and he had a lot of anxiety about being in front of people and expressing his voice. When we were getting ready for this UP conference, I also recognized that his technical skills were very good. So I asked him to be a part of it at the Mount Washington Hotel. He did. Reluctantly, he agreed, but he did. And he bailed me out of a bunch of situations, technical, because I am old. So he helped me out, and that didn't go unrecognized by the audio-visual person at Mount Washington. He also recognized that this kid had some ability and some skill, and by putting himself out there, he was impressed. Immediately upon leaving, the gentleman from the Mount Washington Hotel offered him a job for $20 an hour, which was more than this kid could have hoped for. He also offered him a living situation in a condo there that the person had that was vacant. So he went from living in poverty and in a bad situation to actually living on the grounds of the Mount Washington Hotel and having a $20 an hour job. But as we all know, hotels closed down for a while. While it was closed down, we had another UP conference, and I didn't even reach out to this gentleman. He reached out to me and asked me if he could be a part of it again and help out. I agreed he should be a part of it. He didn't want to get paid. He just wanted to give back because he was grateful. And when he did, he hooked up with our media company that was helping us produce this. They also recognized him as being adept at video, audio-visual, and they offered him a job as well. So now he has two jobs, and when Mount Washington's opened up, he goes there. When it closes down, he works for the other person. So that's one person that's been directly impacted through the UP conference and through some of our prevention efforts. There are many more. We've been very fortunate to reach a large group of young adults, and we continue to do so and continue to lead the state with some of the programming we're doing as far as our creative approach to the changing climate and culture. Thank you.
Hi, I'm Mariah Colstring, Drug-Free Communities Program Coordinator for the Haverhill Area Substance Misuse Prevention Coalition, serving the Woodsville and Haverhill, New Hampshire area youth and their families. Our mission as a group is to reduce and prevent substance misuse among youth by working together to build healthy, safe, and drug-free communities. And although our prevention initiatives looked a lot different this year since the onset of the coronavirus, we've still been able to reach our community in very meaningful ways. This year alone, we've grown our youth leadership through Adventure Group at the high school and have been meeting virtually to brainstorm ways in which students can help support other students in these tough times. We've also grown our social media presence and have a brand new Instagram page with weekly content and themes, and it's even student-led. Our coalition is also very proud of our partnership with the Haverhill Rec Department. This fall, we were able to sponsor an outdoor movie for families to attend at a safe social distance and look forward to more opportunities to support this organization in the future. Although at times the work that we do seems hard to measure, it's times when a community member comes up and asks to speak with you after a presentation that makes it all worthwhile. At one of the events our coalition held, we brought in a speaker to discuss his life and struggles with substances and how he found his path to recovery. At the end of the presentation, someone approached me to let me know that they'd only been sober a few days and decided to attend the event and found to their surprise that it was a huge turning point in their life and in their decision to remain sober, and what is so important about prevention in our communities.
Hi, I'm Annette Carbonell, and I am the Senior Program Manager at the North Country Health Consortium. And I oversee our programs that are involved with our community health workers. We started community health worker programs approximately 5 years ago. The first program that we initiated was Ways to Wellness Connect. We sought out funding from HRSA, which is the Health Resources Service Administration, to support a program where community health workers would work with members of the community 65 years or older who are dealing with unmanaged chronic illness, such as COPD, diabetes, heart disease, that sort of thing. We developed relationships with medical and social service providers across the region of Northern Grafton and Coos County, and they referred patients to us who were unable to achieve health and wellness. And our community health workers would go into their homes, get to know them, build a trusted relationship with them, and help sort out what their needs were and what the barriers were to achieving wellness. Many of these were social determinants of health, whether it's money for food, whether it's safe housing, whether it's not being able to afford your prescriptions. And basically the CHWs are the connectors between that person in need, the healthcare and social services that are out there, and all the other resources that are within the community that can help them achieve this wellness. With our success of that program, as you can see from the annual report and the number of people we've been able to serve and help, we determined that there was another chronic disease that really needed to be addressed in the North Country, and that was substance use disorder. From there, we sought out continued funding or more funding to build the WARM program, the Wellness and Recovery Model. And as I said, this is a program that focuses on the chronic disease of substance use disorder. Here, we took what we learned with the community health worker program, and we joined that with recovery coach work. And so the staff in this program is duly trained as community health workers and recovery coaches. And they work hard to connect people dealing with substance use disorder before treatment, during treatment, in their recovery, or maybe those that are at risk of relapse. And again, they make the connection to all these recovery and treatment and prevention resources that folks need, in addition to, again, addressing the social determinants of health. Many people that have substance use disorder are homeless. They have no transportation. They do not have any warm clothing. And part of their recovery is trying to pull together all of those pieces so that they have a safe and secure life. In addition, the WARM program works with a lot of the agencies that you see listed in the annual report. In addition to providers and behavioral health workers, we work with police departments, we work with first responders, and many other social service organizations, such as those organizations that support homeless folks. Our most recent new addition to our programming for SUD is Ask Petra. You can find out many more details about Ask Petra at askpetra.org, and I hope you will visit the website. Ask Petra is a multi-pronged approach to addressing substance use disorders in the North Country. So as you can see, Ask Petra stands for prevention, education, treatment, recovery, and assistance. These are the 5 components needed to really combat substance use disorder in our area. We enlist our community health worker recovery coaches to man a call center. We have a resource-rich website, which I hope you will visit. There is something for everyone. There are specialty trainings listed on this website for providers. There are resources for police departments and first responders. There's information about harm reduction. What is a syringe services program? There is ways to get the overdose reversing drug naloxone. There are resources for families who are looking at how to prevent their children from dealing with substance use disorder. And finally, but not included in the annual report, I will just say to you that we have now moved on to a new program to address neonatal abstinence syndrome, again, using our community health worker recovery coach workforce.
My name is Amber Culver, and I'm a community health worker and the Ways to Wellness Connect program coordinator and supervisor. Community health workers are the provider's eyes and ears, the glimpse into the home, the patient's advocate and storyteller, and the glue in a multifaceted and sometimes confusing healthcare system. Before Janet had a community health worker enter her home, she was not managing her diabetes and didn't have a handle on her medication routine. She told me she didn't understand why the pharmacy kept filling her medications because she had plenty. I discovered that her plentiful stash of medications was actually a duffel bag full. Together, we learned how she could use pill boxes and what routine would work in her life. I provided her with education and encouragement, communicating our progress directly to her provider. In the beginning, she needed step-by-step instructions on how to fill her pill box, but within a handful of weeks, she would have her pill boxes ready and filled by the time that I arrived to review them. Not only did her A1C and memory improve, but she gained so much confidence. Watching her brighten over our time working together was a huge win for me as a community health worker, and that's why I do what I do.